A couple of seconds here. All right, we are live.
Excellent. Thank you, Dominic. And hello, everybody. Savante Myrick, Mayor of the City of Ithaca. And today it's my pleasure to introduce our speaker, Anne Milgram. You know, we've embarked on this collaborative effort to reimagine public safety in both the City of Ithaca and Tompkins County. And we committed to look both internally for insights and externally for models from visionaries and communities that have made sustainable progress towards more equitable policing and public safety strategies. So Anne is one of those visionaries from abroad being anything outside of Tompkins County, of course.
New Jersey.
So in New Jersey, that's what I mean. We don't need a passport yet to travel to New Jersey, though who knows after November. So Anne is the former Attorney General of New Jersey, Assistant District Attorney in Manhattan's District Attorney's Office, and federal prosecutor. She's currently a practicing attorney and professor at the NYU School of Law. And when she was AG of New Jersey, that's obviously the state's chief law enforcement officer. She oversaw the nationally recognized reformation of the Camden Police Department. Now, at the time, Camden was a city that had been ranked as one of the most dangerous in America. And Anne's approach to use data and analytics to reduce violent crime while implementing effective law enforcement reforms that changed the culture and the practices of both policing and courts to make Camden a safer community. So Anne is here to share her perspective and experience from Camden, and then we'll make some time to answer questions from us, from those of us who are local. So a special thanks to the Center for Policing Equity, who we've been partnering on throughout our collaborative process and who helped facilitate this conversation and bring in such a luminary. So thank you, Anne, for being here. Please, everybody, welcome Anne Milgram.
Thank you so much. And I'm really excited to be here with you today. I love the approach that you're taking to thinking about public safety. And one of the things we did a lot of in Camden was collaborative conversations with the community. And so you're already, I think, far ahead of where we were when I started. Just to give everyone a little bit of background, because I think it can be helpful. People have been talking a lot about Camden recently, and the sort of implication with Camden is that it happened overnight. And really, I think it's important to understand that nothing could be further from the truth, that it was, it's simple, but it's hard. And it took us a lot of time. And frankly, the key ingredient really was political will. And so the fact that the mayor is here today and facilitating this, I think will make such a difference in the work that you do in Ithaca. So I was sworn in as AG on June 29th of 2007. I'd never overseen a police department. As the mayor just said, I was a criminal prosecutor for many years. And on day one, a prior AG had taken over the Camden, New Jersey Police Department. And so on day one, I was in charge of essentially the police department of the most dangerous city in America. We had a murder rate on par with Honduras. We were losing people left, literally almost every day there was a call about a shooting, a homicide, or just a devastating problem in the community. So I was sworn in on June 29th, which I remember, 2007, and July 4th was 5 days later. And I basically got a call late that night, and there'd been a shooting of Pee Wee Coleman, who was basically assassinated gangland style outside a housing project in Camden, the Branch Village housing projects. And I asked for more information. I was asking questions. There were more than 20 shell casings found at the scene. And I sort of had my prosecutor hat on to start to understand, who did it? Why did they do it? Do you have a suspect? And then after a short period of time, the individual on the other end of the line said, Pee Wee just turned 12. And so that was, for me, the moment in the sand for me of this, conversation I was having, thinking about as I'd always thought about criminal cases, and all of a sudden realizing that I was literally in charge of a city where a 12-year-old had just been shot and killed at 11 o'clock at night on the 4th of July. And so that started this quest for me to really understand what was happening. And what was really, I think, important looking back was the fact that I didn't come in with preconceived ideas or notions about what policing is and what it has always been. I come from a long line of police officers. My grandfather was a police officer and the chief of police. My great grandfather was also a police officer and the chief of police, both in a small town called South Amboy, New Jersey. But I'd never done policing. I'd done criminal prosecution. I'd done civil rights prosecution. I was leading the human trafficking prosecutions nationwide when I left the Department of Justice. And so this was really new to me. And so I went down to Camden and I wanted just to understand the basics of what was happening. I wanted to understand what we were doing, if it was working, and whether or not we could do better. And I wanted to understand the sort of community feeling about how we were doing business. I took a ride along. I've told this story before for any of the folks who've seen a TED Talk I gave a while back. I took a ride along. I didn't see a single police officer. I heard sirens and lights and I saw like a car flash by, but I didn't see a single officer walking the street. And there was just this sense of a lack of safety in the community. I didn't see kids in parks. I didn't see kids walking to and from school. And so, I had a sense that something was wrong and I couldn't really understand it. And then I went to what's known as CompStat in policing, and you probably have a version of it in Ithaca. I had seen the one at the NYPD, which is really something to behold, where senior police leaders are they're pulling data about where crimes are being committed, what trends are happening, are crimes going up or down, are there certain things happening in specific neighborhoods, what complaints are coming in from the community. So I went to this in Camden, and it was nothing like what I had seen in the NYPD. It was basically officers writing on yellow stickies about crimes that had occurred and putting them on a map. And so it was really clear that people were working hard. It was also really clear that we actually couldn't answer those fundamental questions that I was asking about what were we doing, was it working, and could we do better? And we also couldn't answer the question of what were the community's concerns. And I'll take a step back in a couple minutes to work I've done since Camden, but I think it's really important to note that we then started and we just went in. I hired this amazing guy, Joe Cordero, who I've recently partnered with again to work in the city of Indianapolis, which I'm sure I'll talk a little bit about later today. But Joe he was the police chief in Massachusetts. He was an inspector in the NYPD. And then at the time I hired him, he'd been the police director in East Orange, New Jersey. And he had overseen about a 65% drop in violent crime in East Orange. And honestly, I couldn't believe it. When I went up there, I sort of was questioning the statistics and the data. And I spent a day with him. And I was just absolutely convinced that he had figured out something that we hadn't learned in Camden, and that I think we haven't generally learned in American policing, which is that it does not work to be reactive to crime. It does not work to wait for the next 911 call to come, to send an officer or a unit, even if you could go quickly, which in many cities we don't go quickly enough. But even if you could go quickly, you're still waiting for something to happen. And in communities, when you want safety, safety is more than just the absence of crime. And so if a child can't walk to school because a gang is basically interfering with that kid, the kid has a choice of joining the gang or not going to school, or maybe getting beat up or hurt. That is not a crime necessarily at that moment in time. It may be a future crime if that child joins the gang. It may be a crime if somebody commits violence against a kid on their way to school. But it's still, any way you look at it, it's a public safety problem. And it's a long-term issue in a community that needs to be solved. And so the problem with waiting to react till you get the 911 call that a crime is in progress is that you're really basically giving up on safety in a community. You're waiting until something happens. And to me, the question is really, how do you be proactive about safety? How do you define what safety means in your community? And then how do you build your data systems, your processes, the deployment of officers, the deployment of community workers or outreach workers, community meetings, technology to pull insights and concerns from community members about what's happening on their block. Is there a problem with kids walking to school? Are people not feeling safe being in a park? All of that matters enormously. And it was literally not, it was the opposite of what we were doing. We were just reacting. And so I brought Joe on board to help us figure out how we could become proactive and not wait for things to happen. The two other key things I think we did in Camden, and I can go through this in more detail as we go on, but one was we thought a lot about accountability. Now, in a lot of police departments, and I work in a lot of police departments, it's actually a problem when you talk about accountability for two reasons. One, there's not enough accountability of senior leadership for equity, for fairness, for keeping crime rates down. there's also, in most of those police departments, not a lot of information that the police leadership has, or that even the line officers in the department, or even the police chief has. And so I feel very strongly that accountability is one of the key parts of American policing, and that it really does lead to changes in communities. And making officers and police departments accountable for community safety and for hearing the community and the community's voices, to me, is critical. But you also have to be fair, and that means you have to give information to the officers, and you have to set expectations. And so we've now encountered this in the last couple of months in departments that we work with, where we have senior leaders saying, in serious violence, communities that are racked by violence, saying, I want to hold the officers accountable, but I can't hold them accountable for things they don't know and they can't see. And so there's a lot of work, I think, that needs to be done around data and around just making sure that we are creating systems that let us figure out how to do things well. The other piece in Camden, and then I'll talk generally about a couple of other things that I think are important. The other piece was really the community piece. And I can't begin to stress enough how important it is to have the voice of the community in the conversation about public safety, and not just till you make changes or you change policies, but long term. And that's because it's critically important to have the trust of the community when it comes to solving crimes. And so it's also really important to know, the community is your eyes and ears of where there are problems that are percolating. And so this is something we built technology around it to have it be easy for residents to be able to say, on this street corner, they could literally make a mark on a picture, on a phone screen or on a computer screen, saying, like, there's a problem here, or just to basically communicate in a lot of different ways, and to give citizens also surveys, just to basically regularly be asking, like, how are we doing? I think all of us now know that you walk out of a bathroom in an airport or a train station, and there's like the little faces: green, you're happy; yellow, you're not so happy; red, you're really unhappy. And we haven't really done that enough with law enforcement, even though we are, public safety and a community service. A couple other pieces about Camden that I think are worth just sort of noting. I said it up front, but I'll say it again. Politics of this stuff is hard, right? And by that, I mean that, police departments, we've run them in a certain way for a very long time, and change is hard. And so I will say that I think that the vast majority of men and women in police departments across America are amazing. I will also say that I believe that our system suffers from systemic bias and flaws that go far deeper than any individual police officer, right? And so I think when we think about structural reforms and cultural reforms, we have to think about how we do it in a way that basically makes our communities safer, right? And to me, the North Star is always public safety. How do we keep communities safe and engaged, and have that dialogue back and forth between the community and the law enforcement folks versus us versus them? And again, I support people being vocal when they don't like something happening in a police department. But I think it's really critical for the police department to build into its nervous system the sentiment of the community and the feelings of the community. So I think it's worth noting that in Camden, after we had dropped violent crime, within about a year, we dropped violent crime by about 40%. Then the state hit big budget cuts. And the key factor in deciding to push ahead and to make changes to sustain public safety gains was the community, right? The voices that were the loudest were the communities, people in the community who basically said, we believe we can be safe, and we now have seen it, and we want to be safe. And so we're calling upon you to essentially do your jobs. When I talk about it being hard, I will talk also nationally about something I see, which is that, as a rule, we put police chiefs in when they're about to retire, right? Policing is civil service driven in many states and cities. There are civil service tests that people have to take. And in my personal view, there's two challenges that come with that. One is that if you put a chief in and they're going to leave in a year or two, it's really hard for the community. It's hard for the officers. There's a lot of jockeying among senior leadership to be the next chief. And also, frankly, people know that they could outlast or outweigh some of the changes that are coming through. Maybe most importantly, I don't think it rewards innovation. And so, the chief, and I had a lot of failures, I should say that. And I had a lot of support, so I was given a lot of leeway to fail. I was the chief law enforcement officer. I had a governor who had a lot of confidence and believed very much that we were trying to do the right thing, and had, frankly, a lot of patience as we made a lot of changes, and things did not always work. But the chief, who I think now is really well known and did a phenomenal job for over a decade, is Scott Thompson. Scott was my third chief in like 2 years, right? And so we had gone through a lot of changes and a lot of problems, but Scott was just the most innovative person in the department. He had 14 years on the job when we made him chief, and he was able to oversee this incredible transformation over a decade. And the fact that he had that amount of time, to me personally, I think is really important. And I think we don't talk enough about how we appoint chiefs, how we make internal decisions about promotions, about how we sort of groom leadership for the next decade. And I think it really matters. I also think one of the things that we learned in Camden, we did a community collaboration that was much like, I think, what you're doing, although it was in person. And we talked a lot with the community about what they wanted to see in officers. And the answer was empathy, fairness, kindness, people who were willing to sort of be a part of the community, were community oriented. And that also went a long way as we started to try to hire folks that Scott refers to them as guardians, not warriors. And so we did a lot of crime fighting work. It's a critical part of the work that we did in Camden and that I've now done in other cities, because in my view, you have to stop violence, and you have to, we do know how to control violence, and it's just critically important that we do that. But it's not enough, right? And your average police officer needs to be in the community. They need to be engaging on issues that matter to the community. And it matters a lot how people are treated. And in my view, is one of the critical parts of policing. A couple of other points to make before I think we could sort of open for questions or conversations. Part of the national conversation right now, well, there's two things. I'll come to the national conversation in a second. Let me do sort of a bigger picture public safety conversation, which is that for the past couple of years at the NYU lab that I direct, we've built a screening tool for the police to identify individuals who suffer from mental health and substance abuse. I did a project in Camden when I was at a foundation where we looked at the overlap of frequent users of the healthcare system and frequent users of the criminal justice system, people who are arrested frequently and people who are in the ERs frequently. And we found a 67% overlap. So 67% of the people who were frequently arrested were also frequently in and out of ERs. And that sort of led me to this really, I think, point where people have been now for a long time and are talking a lot more about now, which is that crime is often not the thing. It is often the end result of many other things. And we have not done an effective job as a rule dealing with some of those other challenges, like people who suffer from a mental health disorder, a substance abuse disorder, homelessness, suicidality, and those types of things. So over the past sort of 3 or 4 years, we've worked a lot on how could we give something to law enforcement that would make this a point where they could divert people and have a somewhat objective tool to rely on. As part of that, we've now looked, as we've done research studies, and we found that almost half of the people in the system would be eligible for diversion based on mental health, substance abuse, or suicidality. And that is a lot. And so I think that as we move forward with these conversations, that we're having a lot of conversations about policing and what happens from the moment that 911 gets called. And I think that's really important. I also think it's really important that as the mayor and others consider public safety, that we understand that there is something called social determinants of health, and those are the conditions in which we live, the conditions in which we work, we play, we go to school, and they tend to involve things like housing, education, poverty, racism, violence, trauma, housing instability, and those things have a huge impact on all of our health. And we are now doing research with the medical school at NYU. We're about to embark on a project with them to look at the social determinants of public safety. Because, for example, we know that kids who graduate high school are far less likely to engage in crime. We know that kids who have better reading scores in 3rd grade are far less likely to engage in crime. And so we need to have this conversation about what makes communities safe. It's not just waiting until something has happened to react. It's thinking about all the ways in which we improve public safety so that that call never comes, right? So we don't get to the point of having the 911 call. So I'm a huge proponent of that type of work. And I really believe that as governments, we have to start thinking about it. Then most of the national conversation today is at the point at which people have called 911. That is also a critical part of the conversation. And the way that we're seeing this evolve, I think, is really important. So almost any police department, if you pulled all the 911 records, you would find 60, maybe, say 50 or 60% of all calls for service, meaning calls for help, come in and are criminal at the beginning, meaning shots fired, someone stole my car, um, a man just broke into my house, whatever, it could be a woman too, whatever it is, but some indication on a phone call that a crime is either in progress or was just committed, versus about 40% of the other things that police officers deal with. And a lot of those are things like welfare checks. I'm worried about my brother. He has mental illness. I haven't seen him. There's a homeless person on the street. It could also be a car accident without injuries. And so we spend a lot of time dispatching officers to things for which there may be alternate responses. There will also be things, and I think this conversation is starting nationally, where it's good to not just send an officer, but maybe also to send an officer and a social worker, or to send a mental health counselor. If it's a welfare check, it probably could be an alternate response, a community health worker. If it's a call of an individual that's having emotional disturbance problem with a knife, that is going to be a police response. But the question is it just the police, or is it the police and others? But I think to the extent we can pursue this conversation and pull data to really understand what calls are coming in, what are we doing with them now, and what's the ideal way we would want to see a community respond, that's a really important part of the conversation. And it's really important because it also de-escalates circumstances, and it frees the police officers to do the work that they should be doing, which is addressing things like crime in the community. I want to talk about one last thing, which is that in addition to all these things that I'm sort of talking about, I think we also have to talk a lot about being transparent, and sharing information about where crimes are, and again, not with specifics, but sort of whether it's the racial and gender breakdown of the police department, whether it's information on discipline. These are things which, sort of how many officers are out on sick leave, even, like, there's a lot of information that police departments have traditionally not shared. And I'm a big proponent that we can't share investigative information, but I believe that there's a lot more that can be shared than has been shared. And I think that part of the conversation has to happen nationally as well, along with conversations about how do we really start sharing community just interactions in a way that people feel good about, and start to really embrace public safety. I have a lot more I could talk about from Camden. I could give you some very specific examples of ways in which I think we use data to change policing from being reactive to proactive. But I want to, I've talked for about 20 minutes, and I always sort of feel like would be really helpful to hear from folks in the community. What can I, focus on that's helpful? Again, this could be a 2-day conversation.
Yeah, that's great. Thank you, Anne. I'm going to invite the folks who've signed on to the Zoom webinar. If they use the raise your hand function, I will click the allow to talk button and let folks make a comment, share a question. Otherwise, we do have some questions coming in through our YouTube as well that we'll paste in. But if anyone on the webinar would like to ask a question to Anne, please feel free to raise your hand, and I'll elevate you to speak. I have one here, Cindy Walter.
Hi, thank you so much for sharing. I really appreciate it. I'm the executive director at BOCES, where we have a criminal justice program in the Ithaca area in Tompkins County. And so we have a 2-year program for high school students, and we're preparing them to come into law enforcement, many of them. And so we're also looking to just make sure that we're in line with all of the criminal justice reform and preparing them, and want to make sure that we do some work on addressing biases, things like that. So, and just thinking about us making sure that we're aligned with the changes that are happening and preparing them to come into the field. Is there anything that you would suggest for us to be considering or thinking about as we're preparing these young gentlemen and ladies to come into the career?
Yeah, it's a great question. I believe training is so important, and that traditionally we've trained on crime and crime sort of interdiction and what do you do when you encounter someone who's violent, all of which is critically important, but it's only a part of the job. And so I think a lot of the training has to be focused on how do you serve your community? What does that look like? And also understanding data. And I know that this may sound strange, but like really policing is traditionally been anecdotal, meaning an officer goes on the street. And actually, let me step back and say it a little differently, which is that my grandfather, when he was the police chief in South Amboy, New Jersey, he used to tell the story of they didn't have 911 at the time, right? The 911 is from it's recent. I mean, there might be some young people on the phone who on this call who were not born at the time, but really it's pretty recent. Police officers used to walk around communities. There was an air siren that would go off. My grandfather would knock on someone's door, go into their house, use the phone to call the precinct. And he was part of the community. And we've essentially, by becoming more reactive and by being more 911 focused, we've actually let officers sort of remove from the community in a way that's really, in my view, not positive. And so part of basically the work that we do is we basically say, look, your anecdote matters. It matters what you saw on that street corner. It matters what you saw last week, the person you arrested, but it's simply not enough to really understand where crime is a problem, what the problems are, how to think about public safety in your community. And, again, this is why, like with a lot of the work I do, we automate some of the data. So we automate community concerns, we automate crime, we automate so that we can be able to tell an officer, look, on that street block today, we want you to go do a directed patrol because there's a real concern about homelessness. We don't want you to arrest anyone. We want you to call the social service agency. And if you can, partner with them and see if you can help somebody. That's a different mindset than reacting to something that's happened where you're going in to make an arrest. And I think the training needs to be reflective of what modern policing should be. And so, look, I think it's a great question. I would also suggest this, because I think the bias conversation, and look, Ithaca has CPE. You're very lucky to have the Center on Police Equity. They're pulling data on bias. I will tell you what we see nationally, which is that we work with a lot of folks and we pull data, and we see that there are just disparities in length of detention, in prosecutions, in bail being set. And I don't want anyone to think that means that there is an officer or a prosecutor or a judge who is intentionally biased against someone. It means that whatever's happening in our system is leading to inequities. And there may be people who are biased, of course, that happens. There's also a deeper systemic issue. And the way to deal with that, in my view, is to track it, to understand it, and to basically get folks familiar with, look, we have to be really honest about what's happening and then work to solve around it and to stop it from happening. And to sort of take some of that training and really make it about being able to see the sort of world a little bit differently than just the reactive. You get the 911 radio, run and you go.
That's really helpful. Thank you so much.
Thanks. Next, we have George McGonigal. I'll allow George to talk there. There you are, George.
Thank you. Thanks for coming in and sharing your stories with us. In Camden, were you able to get officers out of their cars and back into the neighborhood, talking to people? We need to do that here, and I'm wondering if you did that, how you did it.
Yeah, it's a great question. So, we went from where I started, which is we didn't even have officers in cars in neighborhoods, right? And so we spent a lot of time redeploying the entire force. And the first thing, to just be nitty gritty for a minute, is that we did a deep data dive. Again, I didn't go into too much detail, but like I wanted to know On a 12-hour shift, what were officers doing? How many radio calls were they doing? Why were they basically like, I wanted to understand why I wasn't seeing folks on the street. And we learned a few things. We learned that officers were just responding to 911 calls constantly, that it was taking them so long to get to calls that people were calling again. We learned that it was taking officers so long to get to calls that people were actually saying shots fired, because if they just said that their car was stolen, no officers would respond. And then we also learned that this fascinating thing, which is that we had single officer cars, right? And the idea was that if you put one officer in a car, you'll be able to have officers in you'll be able to respond to more radio runs, you'll be able to 911 calls, you'll be able to do a better job. And it turned out it was the exact opposite in some ways, because the officers did not feel comfortable or safe by themselves in a car. It was a totally legitimate argument. It was a totally legitimate conversation. My response was to change the way we dealt with it. And we put 2 officers in per car, and we said, you got to get out of your cars. And we did something called directed patrols. And they still do them in Camden. We have encouraged them in other cities, where you basically say to the officers, and again, you're using crime information, you're using 911 call information, you're using community concerns and sentiment to say to an officer, look, we want you to go spend 15 minutes on this block. There's been a burglary problem. We want you to talk to people in the community. We want you to get to know folks. Then an hour later, we're going to send you to this other neighborhood where we've had car thefts, and we want you to be focused on that. And when you do that, first of all, the officers start to develop relationships in communities, which is they typically really enjoy. And you start to be really responsive to what the problems are in the community. And that leads to much more positive community relations. It also starts to prevent crime, right? Which is the goal, which is to be really proactive at driving down crime instead of waiting for it to happen. We also did a lot more, I think, specific work around identifying the small but critical number of people in a community who commit violence. In any community I've worked in, Camden is a city of 80,000 people. There were maybe 50 people who we thought would be the next shooter, maybe 80. And so we constantly were trying to understand like where the threats were coming from and, how to basically stop those happening as well, but really to spend the bulk of our time in the community. To the point where actually I should tell you this, and I don't think you should do this tomorrow, but Camden no longer has a patrol division. They don't have a unit that responds to just 911 calls. They have officers in the community, and they've gone from, when I was there, I don't know, 13 or 14 911 calls per shift per officer to like 2.5 now. If you think about, you've got 10 or 12 hours and you've got 2.5, 2 or 3 radio runs where you're doing something, the rest of that time is spent in the community versus when it was 14, and then you're literally running from call to call.
Thank you.
And next we have Ted Shealy, and then a few other folks, and then I'll ask some questions that have been submitted via writing. So I'm going to allow
Great.
Ted in. Ted, you should be able to unmute.
Hi.
There you are.
Yep, there I am. Hi, Anne. It's wonderful to see you, and thank you so much for coming. I am a big, longtime fan of your podcast with Preet, and I've listened to your one that you did last summer about Camden a couple of times. So I work at the county health department, and one of the things I do is related to the community health improvement plan, which is based on the state prevention agenda in New York State. I'm not sure if you're familiar with that, but it has in the last really cycle gone all in with social determinants of health, which is something that's been around for a long time, but seems to have hit the mainstream just in the last almost last couple of years. So that's really interesting to me. It was like perked up my ears when you used that term, and I was certainly interested that that term is also incorporated into public safety in your policing and crime prevention work. The other thing, though, that is really interesting to me is is the data part. And one of the things that we're starting to really focus on related to the community health improvement plan is more granular data about related to equity and really down at the base of equity, and trying to think about, or we are thinking about and trying to figure out how to work in so that everybody is collecting the same data all the time. And it's just, it's simple data. It's simple data like race and ethnicity and a few other basics, so that we will be able to know where we stand with that information. We are a progressive community, and we can always say that we're, there's lots of racial equity here, but I'd like to prove it with the data. So I'm just, I don't know if there's a question in there as much as just a comment about the data. And I guess the question would be making sure that there is consistency and fidelity and that it's collected. And one of the things is that we, Ithaca Police Department is there. But really, this is, there's 3 big police departments or law enforcement agencies in Tompkins County, Sheriff, Cornell Police, and Ithaca Police. And they all have to collect the same data. And it's all, if we get into this data thing, that's, it's just, that's my question, I guess. It's just the process of collecting that data.
Yeah, I think it's a great question. I also think that simple data is good. In some ways, what we find sometimes when we will work in a police department or in a community is that there's just a lot of data and people are not sure what data matters and how to use it. And so I'm a big believer in simple. I'd make sort of 2 comments, which is the work around social determinants of public safety is pretty ground floor. And so this came to me, I was giving a talk for a healthcare group last year, and I wanted to sort of I was looking at the social determinants of health, and I had this reaction, which of course I think everyone has just viscerally, which is all these things are the same things that impact crime, right? Unstable housing, mental health, trauma, violence in a community, like all these things are intertwined. And so I found all these studies basically connecting between like a lack of stability in housing and crime, poverty and crime, racism and crime, poor educational outcomes, and like you could sort of everything that is a social determinant. I was finding one-off sort of connections, and what I realized eventually is that we've really siloed the way we look at the world, and so it's not between housing and crime or racism or trauma that's driving just poor health outcomes. It's also driving poor public safety outcomes. And so we think that the overlap between the social determinants of health and social determinants of crime will be about 70, 80%, maybe a little higher. We don't know. So we're going to do a study. Indianapolis is one of our pilot sites. We're looking for other pilot sites. We have not picked them yet. But the idea being to like really do the data work to try to understand where things are connected. And just to that point, when you think about the way we collect data or the way we sort of deal with safety, and I'm going to sort of take it to the next level, and I won't stay there that long, but as a rule, each of us interacts with separate government institutions, right? So I'm one person and I could interact with the health department, the educational department, the social service department, the housing department, child welfare. As one person. Each individual department sees us as separate, right? There's no sense of centering the person in the sort of way we think about public safety or frankly, a lot of other things. And the problem with that is that it's really hard to sort of put people and put families in a situation where they can succeed and flourish when we are not seeing the 360. And so, somebody's doing a housing application here, they're in the ER at a moment in time. And I'll give you the best example I've seen of this. The study I talked about in Camden with the overlap of health and crime. At one point, Jeff Brenner, who was running the Camden Healthcare Coalition at the time, he pulled the family data, and we found this amazing thing around kids in truancy, which is that a lot of them were in the ER the week that they missed school for things like ADHD or asthma. And a lot of their family members, including their moms, were in the school the week were in the hospital the week that they missed school. So it was this moment for me of thinking, each of us sees our sort of silo as separate, and yet they're all interconnected. And understanding that interconnection means you can have someone at the hospital figure out how the kid gets to school the next day, instead of just a nurse giving, milk and cookies to the kid who's, sitting in the ER because his mom's there. And so anyway, I think that this is where the world has to go. We have to be smart about the data. We have to protect people's privacy, but we have to sort of recognize the power around sort of understanding what's happening in people's lives, the 360 of it. And also on questions of equity, the way to do it is to track it.
Great, thank you. The next question we'll have is from Martha Robertson, who is also a county legislator here in Tompkins County.
Hello, am I on here? Okay.
Yes.
Thanks very much for being here. Really very interesting. I had one question lined up, and then you said something else that made me think of a second one. I'm going to squeak them both in. I heard on the news a story about Camden this summer, and if I get this right, what I heard was that when the new police chief came in, all of the officers were asked to resign and reapply for their positions. So if you could tell us, if that's true, tell us about why and what happened with that. And then you said a minute ago that there were 50 to 80 people who could be identified as the next shooter. How is that not profiling? I mean, what does that mean? Why do you say that? And how do you feel about that?
Yep. So let's start with the police chief, and then we'll go to the sort of the people who commit violence, or who we sort of think about in those terms. So the police chief that I was talking about, Scott Thompson, I put him in officially as the acting police chief in 2008 when I still controlled the department. When I left being AG in 2010, I made Scott the full-time police chief. The governor also switched over, and Camden and Newark both had been the recipients of something called distressed city aid. I don't know if we have it in New York State. It was basically that at the time, both of those cities didn't have ratables. They didn't have the tax base to basically pay for the public safety services they needed. And so I don't remember if it was $50 million or $100 million. It was a lot of money. That got cut with the next governor. And so that basically meant that Camden had to lay off almost half of their police officers the next day. That was 2011. They went into a spiral. And when I talk about the power of the community, we had dropped violent crime by more than 40%. The community had seen it, and all of a sudden the numbers were shooting up. Like there were homicides, there were stabbings, there were shootings. And there was a real sense that it was not possible to sort of keep the community safe with having almost 50% fewer officers. And so they went round and round, they looked for other solutions. Eventually, the contracts that the officers were under were very high paying. And they dissolved the Camden City Police Department, started the County Police Department in an effort basically to be able to get out from those contracts and to be able to hire more officers. So they went from having about 250 officers to having about 400 officers for the same amount of money. And again, it was the view of like, how do you make the community safe? They felt that it was important to have officers in the street. And so that was, and the union that existed, the FOP was in the Camden City Police Department, the FOP is in the Camden County Police Department. So I think, it's the other thing I should tell you is that when the officers were let go from that first department, almost like basically the only officers left had been there for 15 years or more. And so all the newer officers who'd been hired, as I was talking about, with an eye to being guardians, not warriors, all of them had been let go. And so there was a real sense of a culture challenge if they didn't figure out how to hire back some of those officers. And frankly, it was, in my view, the right thing to do under dire circumstances that had they not taken that budget cut, they would not have done. On the question of the next shooter, people think that violence is random. It's not. I'll give you the best example is that if you're following sort of a hospital and someone comes in with a gunshot wound, the likelihood that that person could be either themselves or someone affiliated with them could be a shooter in the next week is high. right? And so that doesn't mean you should profile them. It does mean you can talk to them when they're in the hospital and say, look, can we help you? What's going on? Do you need anything? It means if you know what community they live in, you can basically tell the officers who police that community, like, look, there might be a beef between, drug dealers or gangs or whoever it is happening. Keep an eye out. And then remember that there are a lot of informants and other people who work with the police who provide information. And so people provide information often about, this person just bought an illegal gun. I understand they're going to target so and so, and just sort of making sure that that information doesn't just go into one officer's ear and never get understood by the officers who may be policing the community. So it's not to say and I'm shorthanding it and I apologize. It's not to say you make a list of people and you go arrest them. It's more to be sort of sensitive to the fact that crime works in patterns, and that the goal is for nobody to get shot, right? And to disrupt it, and then not to have somebody who gets arrested and goes to jail as well. So again, it's just trying to think a little bit about, what we know and how we can be smart about trying to keep people in communities safe.
Great, thank you, Anne. The next question is one that was written in for us. In what specific ways would you like to see law enforcement officers engage with issues like mental health crises, substance abuse, and homelessness? And how could police departments address these problems differently than social workers and alternate response community health workers?
Yeah, it's a great question. So, I would answer both sort of with a very practical answer maybe, and then just sort of where it's possible we could go, which is that today, we don't have alternate health workers who are being dispatched by the 911 call centers at 2:00 in the morning. We don't have that in most places. We have some jurisdictions, I think Dallas or Houston is one, Johnson County, Kansas is another, where they dispatch mental health counselors, social workers with officers often. We have some communities that are now, and I'm a big proponent of this, putting behavioral health experts in the dispatch rooms to try to help understand when it would be appropriate to send a community health worker or a social worker or a police officer. So I think the reality right now is that police across America are really doing most of this work. I agree that in an ideal situation, there will be a lot of calls where it would be incredibly wonderful to be able to send a trained behavioral health expert. Now, I want to caution one thing with that, which is that I think that there will be times where you could just send a community outreach worker or behavioral health expert. I think there will be times where you just send a police officer based on the call. And then there'll be a fair number of times in the middle where, you get a call with somebody wielding a knife, you are going to send law enforcement, but ideally you also have somebody who is mental health background who could go as well. And then you could figure out in a fluid situation who should be the primary lead, who should take the lead, but or you at least, that's one example. You could also think of other examples that are less clear, where there's a potential for violence, where there's an officer, you understand where the police unit is nearby. But I think it's really important to note that, what's happening in police departments now, some of them are creating like quality of life. I don't love that title because it comes with the sort of ideas of like what happened in the 80s and 90s with quality of life enforcement. But basically, units of police officers, some are armed, some are not, that go out and try to sort of work to sort of solve some of these challenges that are often non-criminal.
Yeah, thank you. And actually, we have a question submitted from one of our community outreach workers here in Ithaca, which is interesting timing for follow-up. Natalia, who's one of our community outreach workers, asks, police often look scary and threatening. What are different ideas to demilitarize the look of the uniform, carrying of the gun, et cetera? A more approachable look and attitude, and then sort of goes on to say a safety commission rather than a militant unit that Black and Indigenous people of color in our community feel comfortable with.
Yeah, I mean, it's a great question. I mean, the uniforms, it is, police departments in some ways are run like the military. In some ways they're not. Having worked in them, the military is more of a chain of command sometimes than police departments, but the uniforms certainly come from that. And some police departments have again put officers on the street without weapons, depending on what their responsibility is. But it's a really interesting question about thinking about, could you change the uniform to be something that is less threatening? And I think, the way I would sort of describe this is the right conversation to have, because the vast majority, I mean, I think everyone on this call understands this, but violent crime is less than 5% of all crime. And yet we've trained officers, we arm officers, we sort of are prepared, and officers have to be, for their safety and the safety of a community. They have to be prepared for sort of the worst case scenario. But we haven't done a good enough job understanding that 95% of the time, 96% of the time, that's not what the job is, right? The job really is about protecting the community, being a part of the community, and serving the community. And so, to the extent that the uniform is intimidating, and I agree with you, it is. I think it's aimed at that sort of 4 or 5% of things that we talk about officers being concerned about, and yet it's really an important part of the job, but by no means the bulk of what the work is. So I think it's a great question. I also think that, look, I follow research really closely. I think some of the research on community outreach workers is incredibly promising, right? This idea of having people in the communities, the cure violence model has had success, I know, where they've sent, sort of community violence interrupters in. And again, I don't think that changes the need for law enforcement and for good law enforcement. But I do think that we should all be open to sort of having these conversations about, alternate models. I do want to also say one other thing, though, and this is really for the mayor and the county folks. There is a time when people call 911, and look, I believe we should do everything we can to stop crime and to stop that 911 call from happening, but those calls come. At that moment, there is going to be someone who needs to go into a community. That dispatch, if it's serious and if it's crime, will need to happen very quickly. And if it's something that relates to behavioral health, that also has to happen within a reasonably fast amount of time. So again, if we think about alternate models, it's not a question of, well, you can just, show up and walk the street from 8 to 8. You can, right, if you're a community outreach worker. But if we really start to think about shifting to, we're dispatching a behavioral health expert to a 911 call, that person has to be on call, and that has to be someone that can be dispatched to solve a specific problem and ideally prevent future problems, right? And so I think there's a lot of value in this. I just think we have to play out the whole scenario and really be thoughtful about what it means, and how, the reason the police have ended up doing a lot of this is that they work 24/7. They're on a dispatch model. And so we've taken this as what's become the status quo. And I think it can be changed. It has to be changed with an eye toward, like, when someone makes that call, they need help, and we have to make sure that we're prepared to give help for whatever that call is.
Great, thank you. Next, I have Graham Kerslick, who is Common Counsel for the City of Ithaca, and then I'll go back to a few from the chat. We got some thoughtful questions in on the YouTube chat as well. Graham,
and thank you very much for sharing some of this. It's been really interesting. So some of the benefits to the community are probably a little bit more obvious, but I was wondering, can you give us an idea about the benefits to the officers? I mean, these changes have been very radical in some cases. So what's the kind of feedback, and are there benefits that the officers see and appreciate after making some of these changes?
Yeah, it's a great question. So, the officers were not all huge fans of some of the changes we made at the beginning. I was sued by the FOP at one point, which is part of doing this work, right? Change is hard. And, basically we made a decision. We wanted officers to get out from behind desks, that we wanted them to be deployed when crime was happening. And we disrupted a lot of people's lives. And so there's always some pushback. Now, that being said, we set up this data system, and it went down about a month after we set it up. And some of the most vocal folks against setting it up were the first people to call to say, it's not working, we need the information, right? We want to know what the crime trend is in this neighborhood, because we're hearing some stuff in the community. And that to me was a moment of, like, we've broken through, because people now see the value, and they've started to understand and internalize why it works. I will tell you that look, modern policing and the stuff we're talking about, it's not for everyone, right? If all you want to do is break down a door, and, be in riot gear all day long, then frankly, most police departments in America are probably not the right fit for someone who wants that job. Most police departments, doesn't even matter if it's the most dangerous city in America, like Camden was, that was a part of the job, but a lot of the job was just being a part of the community and understanding what was happening and being really, we were data driven in closing open air drug markets. We were data driven in understanding like what shifts we should have the officers working. So it really is. And then we wanted officers on the street, and we sent officers to community barbecues, and we, had them out after school when kids were walking home from school, sort of being available and being seen in the community. People went back to the parks that there was nobody in when I started in Camden. And so officers actually really felt good about that, most people become police officers to serve the community. And so, was there a huge amount of resistance at the beginning? Absolutely. I mean, there were, I will tell you guys, and I'm saying it publicly, I don't know if I've told the story before publicly, but there was a amazing woman who was in her 80s at the time. She'd been on, I think, the city council in Camden for a long time. And, we were in it with the redeployment of the officers, and people who'd worked 9 to 5 Monday through Friday, and then started working 6 o'clock at night till 4 o'clock in the morning or 5 o'clock in the morning, didn't love it sometimes. And so, there were calls that I got about stop and frisks happening outside of churches, from this wonderful woman who called me and basically said, keep doing it. Whatever you're doing, it's fine. I just want you to know I got stopped this morning by an officer. And so look, there's resistance, and change is hard. And I think it's incumbent upon us to show the value of that change, and to show why it matters. And also, honestly, to be deeply committed to officer safety. And I always took very seriously that, like, the community safety is the most important thing. Officer safety is the most important thing. And so once you sort of set those things up, but we got a lot of buy-in, and, going from the community not wanting to have an officer be part of that community to welcoming the officer in the community, the feedback was good from the officers. So I don't want to sugarcoat it. We've ended in a good place, but it was, it was tough at times.
Great, thanks. A question we got through YouTube was, folks are thanking you for the conversation. I'd like to extend that as well from our groups. They're wondering how well practices translate from one location to another. Is there enough similarity across departments, and how might you go about comparing Camden and Ithaca?
Yeah, so Ithaca is smaller than Camden, right? I think I'm going to say the wrong exact thousand, but Camden's about 80,000. I think you're smaller.
Yeah, about
and you would have
30,000 in the city. It doubles
right.
with students just about.
Yeah, so smaller doesn't always mean easier, but I do think that they're probably analogous in some ways. I will tell you what I see, and I don't know the inside of your department well enough to really say anything specific to Ithaca. What I can tell you is that I see the same problems almost everywhere I go nationally, which is a lack of understanding of what officers are doing, what they're spending their time on, what the community cares about. Virtually no police department in America has really, Camden does an amazing job of this, and there are a handful of others, but really it's integrated sort of community concerns and sentiment and feedback on officers into the nervous system of the police department. And so I see basically most police departments being really reactive, lacking accountability, lacking connections to the community, not understanding or knowing how to manage their 911 calls and their dispatches. And frankly, also a lot of them don't have good violence reduction programs. Another thing a lot of them are really bad at, and I'm giving you the laundry list in which, and there's varying degrees of this, but many police departments tend to suffer from these same things. They don't fully understand mental health or substance abuse challenges in the community. They may respond, but they don't really track. They don't track things that come in that way. And I think that's a huge missed opportunity to get people treatment, which is one of the few well research established ways to reduce crime in a community is to treat people who suffer from mental health or substance abuse. So, I mean, there's a lot of ways in which policing is not modernized in the way that I think it should. And so, you know, all the things I talk about in Camden to varying degrees, I think are really challenges in other departments. And again, it's a continuum. Some are more successful, some struggle more, but you know, almost all of them, I think, could use the type of deep sort of data analysis that we did, with then an understanding of what our priorities were, how we would effectuate those priorities, and then had strategies to do all the work that we felt strongly about doing.
Thank you. Next, I have Taylor Moon. Taylor, you're on.
Hi. So I'm wondering how, or like what the data suggests about the effects that everything you did in Camden had on racial disparities in policing and, you know, the kind of like excessive use of force cases that have gotten a lot of attention lately.
Yeah, so I think I don't have the data in front of me for the last decade or so. I can tell you that when I was overseeing Camden, we had the feds came in from the unit I had worked in, the civil rights unit, and did a massive civil rights investigation and ultimately prosecuted 4 Camden police officers. So there was a depth of corruption within the department that I can promise you is no longer there. But it was dire in some ways. The officers were planting drugs, they were taking money, and it was for officers who were ultimately charged. And that is a cancer in a police department. And I don't need to tell anyone on this call just how devastating that can be. So Camden has made enormous strides. I don't have the specific numbers in front of me. I think that there are a couple pieces that I would sort of talk about on discipline, which is one, I don't think, you know, I think Camden has done a much better job of being very transparent about it in recent years, but I think police departments need to be really transparent about the number of complaints that are brought against officers, what the discipline is. You know, to me, these are critically important conversations, and there should also be, you know, sort of metrics of, if an officer is found to have done X, Y, Z, we would expect them to get a 2-week suspension or to be terminated. Like, it should be clear sort of what the parameters are. And I don't think we've been effective at that nationally, of sort of just saying, here's the process we're going to follow when there's a problem. Here's what information we'll make public, what information we won't. I mean, officers, they're employees, they have privacy, their privacy concerns there as well. But really, really being just sort of deeply transparent about it. The second piece I would say is I've done enough work around data and discipline to say the following thing. The vast majority of officers, if they get a complaint a year, they get a complaint a year. The vast majority of officers. And it comes back to the conversation we were having about the small but critical number of folks who engage in criminal behavior, or the people we worry about. The same is true in whatever you do when you understand there's a small group of people that are driving a lot of the problems. And so what do we do when that happens? I can tell you in New Jersey, when I was AG, I oversaw the racial profiling consent decree of the state police. I oversaw the state police. And one of the things that we instituted there was an early warning system and cameras on cars. And so basically what happened is, instead of waiting for a huge problem and a huge amount of discipline, we were able to stop things before they became bad. And it had a huge impact on the overall sort of outcomes and equity and fairness within the state police. And so I think you're asking really good questions. I mean, I would both advocate being more data-driven, more transparent, and thinking a lot about the fact that, again, we have to put the community sentiment and community feedback into the sort of nervous system of the police department. To the point where now in Camden, and this sounds like an interesting thing, but like, so if there's a complaint against an officer, a supervisor may will talk to the officer about that. Or there's like, you know, there's a process through which, if there's, depending on the severity, there might be disciplinary proceedings. But the converse is also true. So if a citizen or a community member writes in and says, Officer Smith was great, a sergeant may shout out at a roll call, look, Officer Smith did a fantastic job. We just want you to know you got a great community, community feedback. And so making it something that we sort of judge and care about as a police department, and then just tracking it, I think goes a really, really, really long way.
Great, thank you. We get another question in the Q&A here. What did community engagement look like in Camden? And I might, expand that to other departments that you've worked with. And what are some of the things that you've done to establish those relationships?
Yeah, so I think I would sort of argue community engagement has to happen on a lot of levels. One, you have to have officers in the community. You just do, right? You have to have people who are get to know members of the community, that the community gets comfortable with them. It makes a big difference. Two, community meetings, conversations that the community wants to have. The police have to be a part of whenever they're asked, in my view, of those meetings. The third is that even with those two things, there are a lot of members of the community that we don't reach, or that we only touch when they make a 911 call, or when they're a witness to a crime, or when something has gone wrong. And so, or they just have a concern in the community. And so in Camden, again, we built sort of the data system to be reaching, to have a way for people in the community to reach into the police department and say, I'm worried about this in my street. I'm worried about this in my neighborhood. If someone interacted with an officer, to be able to give feedback about what that was like. Again, we should all be asking this question of, like, we could do almost everything. We're all meeting by Zoom, which is an amazing thing. Like, we can do almost anything by phone. Like, why haven't we made a commitment to have what the community cares about be a priority for the police department, and really just part of, like, what we think about when we think about how do we deploy resources, how do we pick priorities. This stuff matters. And so I am a huge advocate for community meetings. I'm a huge advocate for officers in the street, but I also think that there have to be other ways. And I am an advocate for technology. There may be other ideas that folks have, but I think it's really important to put it into the lifeblood of the police department and not have it just be, an officer shows up at a community meeting, gets an earful, goes back to the department, doesn't convey any of it. It has to be done in a way that really gets noted and followed in the department.
Thanks. We're just going to ask a few more questions. I want everyone to know, both on YouTube and here, that we're going to archive all the questions that are asked as well and address them throughout our reform process and reimagining process. But one of the questions that came in, heroin and opioid abuse is still killing and causing immense harm to many families. What should be done by police officers to help keep drugs off the streets, especially with reform that you've gone through in mind?
Yeah, I mean, it's a great question. We are seeing huge percentages of opioids across a number of jurisdictions that we work in, no doubt. And look, I think if we did this sort of breakdown of mental health, substance abuse, I gave you the sort of 48-50% stat of the research project we did. I think more was mental health than substance abuse, but the amount that's co-occurring is also very high, meaning that one person may suffer from both challenges. So there are a few things. I mean, I think one is there's a real move in communities, including in Indianapolis. So we started our work in Indianapolis building the screening tool for law enforcement for mental health and substance abuse, to try to just sort of answer the question of why more people weren't being diverted out of the system to treatment. And a lot of what we found was that we weren't training officers on how to identify mental health or substance abuse. We were making it very subjective, so that if an officer, again, with this sort of pretty hierarchical organization, if you give a very junior officer a lot of discretion, sometimes it's not easy to exercise that discretion unless you're sure. And especially if you're saying, instead of prosecuting you, I'm going to give you treatment. If something goes wrong with that individual, they commit another crime in the community, that officer could be held accountable unless there's a more objective way of figuring out, is this the right decision to make? And so we went in with that in mind. Indianapolis has built something called an Assessment and Intervention Center. We're also partnered with McLean County in Illinois. They have a similar model. And the idea being that it's a place where community outreach workers or law enforcement can bring people for case management and connection to community services. And so it's a diversion model, but it's also just a community-wide model that basically allows, it's a lot to ask a police officer to identify someone who suffers from mental health or substance abuse and to know the right location to take them. And so what this does is basically provide the sort of one stop in a community that allows somebody to be screened for, in Indianapolis, they'll screen for mental health, substance abuse, homelessness, traumatic brain injury, and trauma. And they'll then figure out what the right pathway may be. And that's a city funded initiative. Similar thing happening in McLean, again, with the idea of like countywide. There are a number of folks who will benefit enormously from medical treatment, will ultimately commit less crime if they successfully receive treatment, but need some case management and assistance with getting connected to services and treatments. And so, we've sort of, I like that model because I think it's, it sort of really is kind of a case management model. The other model that we've personally worked a lot on is building this tool for police officers that can help identify, should you take someone for mental health treatment? Should you take someone for substance abuse treatment? And the next question is, how will we connect that with services in a community? So for each department we do that with, how will we sort of identify, well, here are the places where someone should go for mental health and here's where they should go for substance abuse, kind of thing. But I think it's the right way to think about, like, if an officer shows up and there's somebody suffering from one of those, either mental health or substance abuse, and in many instances, again, if you think about the number of 911 calls that are non-criminal in nature, the officer just leaves, right? And that guarantees that there'll be another 911 call and that person doesn't get treatment or connected to services. And so there has to be a lot of thought into what the better way might be.
Thank you. And the last question that we have for now is, does requiring police officers to live in the jurisdiction that they work in influence things like police brutality statistics?
I don't know the research on that. I would be super interested in knowing it. I think that that's a really good question. And I'm going to tell you, I don't know. And I'll look it up after this. But, it's ideal for officers to live in the jurisdiction. It's not always possible for a variety of reasons, but I think that different communities have looked at this differently. To me, I'll tell you, my very, very strong assessment is that police departments need to have a diversity of men and women. They need to have a diversity of people of color and white individuals. I mean, traditionally, it's been a pretty white male dominated profession, and representation matters. Having people in the communities that we serve who look like the communities we serve matters. And so I worry more about those numbers and making sure that there are enough people at all levels of the organization, including leadership levels, than I do about specifically where people are living. But again, I think it's a really interesting question and a really sort of fair research question. And I'll look. One thing I'd also note is one of the reasons why some of the research is hard in this space is that it's hard to isolate one thing. And so, we made so many changes in Camden. People have said, oh, did you research this specific thing? We weren't worried about research at the time. We were worried about, making the community safe. And so we did a lot of things at once, and a lot of things we know failed. What the magic sauce was, like, I've given you what I think it is, but we didn't do the kind of research that, I would love to have seen done.
Great, thank you. And I'm going to elevate one more community member who has had their hand raised for the last question of the evening. Margaret, you are up.
Okay. I want to thank you for lifting up community safety and restoring that classic phrase of the police as those who protect and serve. And talking about guardians, not warriors. But there has been a militarization of our society as a whole, but especially within our police departments. And I'm wondering what kind of retraining is needed, not just for helping existing officers have a new mindset about the community, but this is a very focused one, but that reflects this broader change that you've been describing so well. What did you do to retrain reflexes? Like, one of my concerns is that officers are taught to shoot to kill. Their targets have a head and a torso. And I'm somebody, I love the idea of patrols who don't carry any guns at all. But when people do have guns, my feeling is they should really know how to aim carefully, and they shouldn't be aiming to to shoot to kill. And I'm just wondering if there was any form of retraining along those lines to undo reflexes as well.
Yeah, I think that's a great question, and there are a few things that are worth noting. Which is one, I mean, we basically told officers, do not come back making low-level arrests, right? Do not come back with them as a rule, unless there's a reason why you're worried about the guy who's drinking an open 40-ounce bottle of beer on his porch on a summer day because it's hot out and he doesn't have air conditioning. Like, do not walk in with that. And that was a sea change from where the department had been, right? And so the idea was basically like, we want you in the community. We want you to be worried about serious crime. We want you to be focused on that. Obviously, if you see something you think is critically important, like, we're not telling you you can't be an enforcer of the law, but some of protecting and serving is sort of being a part of a community. And so we really tried to just basically, you know, drive that home of how important it was, like, that this was about safety. This wasn't about making arrests for crime. That was one thing. Another thing that I think is really important is constant training. And so I think we have not spent enough time going back over, what do our police academies look like? What are the sort of updated trainings look like? I mean, basically the way officers are trained is by senior officers who've been doing the job a certain way for a long period of time. They get trained in the academy, then they go out and they're taught how it works. And people who violate, you know, what we decide are the norms or how the training should be or the policies have to be held accountable, right? And that's how you change. That's how you start to sort of change the conversation. The other thing, which I think you have a de-escalation policy, but Camden did this a few years back, and I think it is a really important policy, which is the training, and it is, I think, the best de-escalation policy in the country, which is basically to say you do everything you can before you draw your weapon. And it basically puts the responsibility on the officer not to be unsafe. It actually, I think, makes the officer more safe because there's a protocol that they follow to make sure that they're doing everything by the book. If they can retreat and be in a safer spot, they do. But just this idea that, like, your first and most important job is to de-escalate the situation, it's a total game changer. And we've seen incredibly positive results come out of that. And so I think you're right on training. I think you're right on, I personally I favor frequent training to the extent it can be done. But I also think that the policies have to be reflective of the values and they have to be enforced. And so if they're not followed, again, they have to be clear. You know, it's really important from an officer standpoint also, just to sort of argue for this position, like, it has to be clear what they're required to do, and that has to be enforced and followed fairly. And so that lets them know, okay, I'm expected to de-escalate, and if I don't, here's a potential consequence. But it's a great training.
Great. Thank you for the question, Margaret. And thank you so much, Anne. The city folks have a budget meeting they're going to need to use the YouTube for, but thank you so much for participating in this.
Thanks, everybody.
Yeah.
Thank you. I appreciate it. Bye.